Welcome back to MCQs Master 101. Today, we are tackling 50 Nclex questions that fail most candidates. The exact questions that look easy, feel familiar, and destroy scores on exam day. These are not recall questions. These are priority traps, lab traps, medication traps, and safety traps, the kind that separate first-time passers from repeat test takers. Every question comes with full rationales, clear breakdown of why the correct option is right, and why the others fail. If you can score high on this set, you are Nclex ready. Pause the video, think like a test maker, and answer before we reveal the solution. Let's begin. Question 1. A client with diabetic ketoacidosis, DKA, is receiving IV insulin. Which finding requires immediate intervention? A. Blood glucose decreases from 520 milligrams per deciliter to 320 milligrams per deciliter. B. Serum potassium level of 3.1 milliequivalents per liter. C. Urine output of 40 milliliters per hour. D. Fruity breath odor persists. Answer. B. Serum potassium level of 3.1 milliequivalents per liter. Rationale. Insulin drives potassium into cells. Hypokalemia can rapidly lead to fatal dysrhythmias and must be corrected immediately. A fall in glucose is expected, urine output is adequate, and fruity breath may persist early in treatment. Question 2. A nurse is caring for a client 12 hours post-thyroidectomy. Which assessment finding is the priority? A. Hoarseness when speaking. B. Tingling around the mouth. C. Pain rating of 6/10. D. Heart rate of 96 BPM. Answer. B. Tingling around the mouth. Rationale. Perioral tingling indicates hypocalcemia from accidental parathyroid removal, which can progress to laryngostomy and airway compromise. Hoarseness can be expected, moderate pain is normal, and heart rate of 96 is not critical. Question 3. A client with a spinal cord injury at T4 suddenly develops pounding headache, flushing above the injury, and BP 210/110 millimeters per mercury. What is the nurse's first action? A. Administer prescribed antihypertensive medication. B. Lower the head of the bed. C. Check the urinary catheter for obstruction. D. Apply oxygen via non-rebreather mask. Answer. C. Check the urinary catheter for obstruction. Rationale. This is autonomic dysreflexia. The priority is removing the noxious stimulus, most commonly bladder distension. Medications come after stimulus removal. The head of the bed should be raised, not lowered. Question 4. A nurse is reviewing lab results for a client on warfarin therapy. Which value requires provider notification? A. INR 2.5. B. Platelets 210,000 per millimeter cubed. C. Hemoglobin 13.8 grams per deciliter. D. APTT 38 seconds. Answer. A. INR 2.5. Rationale. For most indications, therapeutic INR is 2.0 to 3.0, but Nclex expects recognition that 2.5 is therapeutic, not dangerous. This question tests awareness of false alarms. However, this question is tricky. No value requires notification, making INR the distractor. Many candidates panic here. Question 5. A client with increased intracranial pressure, ICP, is receiving care. Which intervention should the nurse avoid? A. Keeping the head of bed at 30 degrees. B. Maintaining neutral head alignment. C. Performing frequent deep suctioning. D. Administering stool softeners. Answer. C. Performing frequent deep suctioning. Rationale. Deep or frequent suctioning increases ICP due to vagal stimulation. Elevation, alignment, and stool softeners reduce ICP and are appropriate. Question 6. A nurse is preparing to administer IV potassium chloride. Which action is most appropriate? A. Administer via IV push for severe hypokalemia. B. Dilute potassium in normal saline and infuse via pump. C. Mix potassium in dextrose and infuse rapidly. D. Administer without cardiac monitoring. Answer. B. Dilute potassium in normal saline and infuse via pump. Rationale. IV potassium must never be given IV push and should be infused via pump, ideally with cardiac monitoring. Rapid infusion or lack of monitoring increases risk of lethal arrhythmias. Question 7. A client with chronic kidney disease is prescribed magnesium sulfate. Which assessment finding is most concerning? A. Deep tendon reflexes +1. B. Blood pressure 148/90 millimeters mercury. C. Respiratory rate 10 per minute. D. Serum calcium 9.2 milligrams per deciliter. Answer. C. Respiratory rate 10 per minute. Rationale. Magnesium depresses the CNS. Respiratory depression is a life-threatening sign of magnesium toxicity, especially in renal failure, where excretion is impaired. Question 8. A nurse is caring for a client with suspected pulmonary embolism. Which finding supports this diagnosis? A. Bradycardia and hypotension. B. Sudden dyspnea and pleuritic chest pain. C. Productive cough with thick sputum. D. Gradual onset of wheezing. Answer. B. Sudden dyspnea and pleuritic chest pain. Rationale. Pulmonary embolism presents with acute onset, not gradual respiratory symptoms. Productive cough suggests infection. Wheezing suggests asthma, and bradycardia is uncommon early. Question 9. A client receiving blood transfusion develops chills, fever, and flank pain. What is the nurse's priority action? A. Slow the transfusion rate. B. Administer acetaminophen. C. Stop the transfusion immediately. D. Notify the provider after completion. Answer. C. Stop the transfusion immediately. Rationale. These are signs of acute hemolytic transfusion reaction, which is fatal if continued. Stop the transfusion first, then maintain IV access with normal saline. Question 10. A nurse is teaching a client newly diagnosed with Addison's disease. Which statement indicates correct understanding? A. I will stop my steroids once symptoms improve. B. I should increase my dose during illness or stress. C. I should restrict sodium in my diet. D. I will take my medication only when I feel weak. Answer. B. I should increase my dose during illness or stress. Rationale. Addison's disease requires lifelong steroid replacement, with stress dose increases to prevent adrenal crisis. Sodium restriction is incorrect. Sodium is often needed. Question 11. A client with heart failure is receiving furosemide IV. Which finding requires immediate action? A. Potassium level 3.0 milliequivalents per liter. B. Urine output 250 milliliters in 4 hours. C. Blood pressure 138/84 millimeters mercury. D. Crackles in bilateral bases. Answer. A. Potassium level 3.0 milliequivalents per liter. Rationale. Loop diuretics cause potassium loss. Hypokalemia increases risk for life-threatening dysrhythmias. The other findings are expected in heart failure or diuretic therapy. Question 12. A client with liver cirrhosis and ascites is receiving furosemide. Which order should the nurse question? A. Lactulose. B. Spironolactone. C. Furosemide. D. High-protein diet. Answer. D. High-protein diet. Rationale. Clients with cirrhosis are at risk for hepatic encephalopathy due to ammonia buildup. Excess protein worsens ammonia levels. Lactulose and diuretics are appropriate. Question 13. A post-operative client suddenly develops dyspnea, tachycardia, and hypotension. Which condition is most likely? A. Atelectasis, B. Pulmonary embolism, C. Pneumonia, D. Fluid overload. Answer: B. Pulmonary embolism. Rationale: acute onset respiratory distress with cardiovascular collapse strongly indicates pulmonary embolism, not gradual conditions like pneumonia or atelectasis. Question 14. A nurse is caring for a client receiving total parenteral nutrition, TPN. Which complication is the highest risk? A. Infection, B. Hypokalemia, C. Hypoglycemia, D. Fluid deficit. Answer: A. Infection. Rationale: TPN requires central venous access. Sepsis is the most dangerous and common complication. Electrolyte shifts occur, but are secondary risks. Question 15. A client with myasthenia gravis reports increasing muscle weakness. Which medication order should the nurse anticipate? A. Atropine, B. Pyridostigmine, C. Propranolol, D. Diazepam. Answer: B. Pyridostigmine. Rationale: myasthenia gravis is treated with acetylcholine esterase inhibitors to improve neuromuscular transmission. Sedatives and beta blockers worsen weakness. Question 16. A nurse is assessing a client in diabetic ketoacidosis. Which finding confirms metabolic acidosis? A. Kussmaul respirations, B. Blood glucose 450 milligrams per deciliter, C. Fruity breath odor, D. Urine ketones positive. Answer: A. Kussmaul respirations. Rationale: deep, rapid breathing is a compensatory response to metabolic acidosis. Hyperglycemia and ketones explain DKA, but don't confirm acidosis compensation. Question 17. A nurse is caring for a client with suspected meningitis. Which action is priority? A. Administer antipyretics, B. Obtain blood cultures, C. Initiate droplet precautions, D. Perform neurological assessment. Answer: C. Initiate droplet precautions. Meningitis is highly contagious. Preventing transmission is the immediate priority before diagnostics or medications. Question 18. A client with chronic obstructive pulmonary disease, COPD, is receiving oxygen. Which order should the nurse question? A. Oxygen at 2 liters per minute nasal cannula, B. ABG monitoring, C. High-flow oxygen via non-rebreather, D. Encourage pursed lip breathing. Answer: C. High-flow oxygen via non-rebreather. Rationale: COPD clients rely on hypoxic drive. High oxygen concentrations can suppress respirations and cause CO2 retention. Question 19. A nurse is preparing to administer digoxin. Which finding requires holding the medication? A. Apical pulse 54 beats per minute, B. Potassium 4.0 milliequivalents per liter, C. Blood pressure 130/78 millimeters mercury, D. Digoxin level 0.9 nanograms per milliliter. Answer: A. Apical pulse 54 beats per minute. Rationale: digoxin slows heart rate. An apical pulse below 60 beats per minute increases risk of toxicity and bradyarrhythmias. Question 20. A client with a chest tube has continuous bubbling in the water seal chamber. What does this indicate? A. Normal operation, B. Air leak, C. Lung re-expansion, D. Tube obstruction. Answer: B. Air leak. Rationale: continuous bubbling in the water seal chamber indicates air escaping from the system, not expected normal function. Question 21. A nurse is caring for a client after a lumbar puncture. Which position is best? A. High Fowler's, B. Prone, C. Supine, D. Trendelenburg. Answer: C. Supine. Rationale: lying flat reduces the risk of post-lumbar puncture headache caused by CSF leakage. Question 22.
A client receiving heparin therapy has which lab monitored for effectiveness? A. INR, B. APTT, C. Platelet count, D. Hemoglobin. Answer: B. APTT. Rationale: heparin therapy is monitored using activated partial thromboplastin time. INR is for warfarin. Question 23. A client develops stridor after extubation. What is the nurse's priority action? A. Suction the airway. B. Apply oxygen. C. Prepare for re-intubation. D. Encourage coughing. Answer: C. Prepare for re-intubation. Rationale: stridor indicates upper airway obstruction. This is an airway emergency requiring immediate intervention. Question 24. A nurse is caring for a client with acute pancreatitis. Which order should be implemented first? A. Administer morphine. B. Keep NPO. C. Monitor blood glucose. D. Insert NG tube. Answer: B. Keep NPO. Rationale: resting the pancreas by preventing stimulation is the priority intervention. Pain control and glucose monitoring follow.
Question 25. A nurse is assessing a client with hypovolemic shock. Which finding is expected? A. Bounding pulses. B. Decreased urine output. C. Elevated blood pressure. D. Warm flushed skin. Answer: B. Decreased urine output. Rationale: hypovolemia causes poor perfusion to kidneys, resulting in oliguria. Question 26. A nurse is administering morphine IV. Which adverse effect requires immediate intervention? A. Nausea. B. Constipation. C. Respiratory rate 8 per minute. D. Drowsiness. Answer: C. Respiratory rate 8 per minute. Rationale: respiratory depression is life-threatening and requires prompt action. Question 27. A client with SIADH is at risk for which electrolyte imbalance? A. Hypernatremia. B. Hyponatremia. C. Hyperkalemia. D. Hypocalcemia. Answer: B. Hyponatremia. Rationale: excess ADH causes water retention, diluting sodium levels. Question 28. A client with neutropenia is at risk for which electrolyte imbalance? A. Fresh flowers in room. B. Raw fruits and vegetables. C. Private room. D. Rectal temperature checks. Answer: C. Private room. Rationale: neutropenic clients require protective isolation to prevent infection. Question 29. A client receiving chemotherapy reports numbness and tingling in hands and feet. This indicates A. Electrolyte imbalance. B. Peripheral neuropathy. C. Fluid overload. D. Hypoglycemia. Answer: B. Peripheral neuropathy. Rationale: many chemotherapeutic agents cause neurotoxicity affecting peripheral nerves. Question 30. A nurse is caring for a client with suspected stroke. Which action is priority? A. Check blood glucose. B. Administer aspirin. C. Obtain CT scan. D. Start IV fluids. Answer: A. Check blood glucose. Rationale: hypoglycemia mimics stroke. Rule it out first before other interventions. Question 31. A client with acute renal failure has which finding? A. Increased urine output. B. Elevated creatinine. C. Decreased BUN. D. Hypercalcemia. Answer: B. Elevated creatinine. Rationale: creatinine rises when kidney filtration declines. Question 32. A nurse is teaching insulin administration. Which site has the fastest absorption? A. Thigh. B. Buttock. C. Abdomen. D. Upper arm. Answer: C. Abdomen. Rationale: the abdomen provides consistent and rapid insulin absorption. Question 33.
A client receiving radiation therapy should avoid which item? A. Mild soap. B. Tight clothing over sight. C. Loose cotton garments. D. Tepid water. Answer: B. Tight clothing over sight. Rationale: radiated skin is fragile. Tight clothing increases irritation and breakdown. Question 34. A nurse is caring for a client with Guillain-Barré syndrome. What is the priority assessment? A. Pain level. B. Reflexes. C. Respiratory status. D. Skin integrity. Answer: C. Respiratory status. Rationale: ascending paralysis can affect the diaphragm, leading to respiratory failure. Question 35. A client on long-term corticosteroids is at risk for A. Hypoglycemia. B. Adrenal suppression. C. Hypotension. D. Weight loss. Answer: B. Adrenal suppression. Rationale: exogenous steroids suppress natural cortisol production. Question 36. A nurse suspects internal bleeding post-surgery. Which sign supports this? A. Increased BP. B. Restlessness. C. Decreased heart rate. D. Increased urine output. Answer: B. Restlessness. Rationale: early signs of hemorrhage include restlessness and anxiety due to hypoxia. Question 37. A client with hyperkalemia should avoid which food? A. Apples. B. Rice. C. Bananas. D. Bread. Answer: C. Bananas. Rationale: bananas are high in potassium and worsen hyperkalemia. Question 38. A nurse is caring for a client with suspected sepsis. Which intervention is priority? A. Administer antibiotics. B. Obtain cultures. C. Initiate IV fluids. D. Monitor temperature. Answer: C. Initiate IV fluids. Rationale: sepsis causes circulatory collapse. Restore perfusion first. Question 39. A client with opioid overdose should be prepared for which medication? A. Flumazenil. B. Naloxone. C. Atropine. D. Epinephrine. Answer: B. Naloxone. Rationale: naloxone reverses opioid-induced respiratory depression. Question 40. A client with peptic ulcer disease should avoid which medication? A. Acetaminophen. B. Ibuprofen. C. Sucralfate. D. Famotidine. Answer: B. Ibuprofen. Rationale: NSAIDs increase gastric irritation and bleeding risk. Question 41. A nurse is assessing a client with hypocalcemia. Which sign is expected? A. Chopstick sign. B. Bounding pulses. C. Polyuria. D. Muscle flaccidity. Answer: A. Chopstick sign. Rationale: facial twitching indicates neuromuscular excitability from low calcium. Question 42. A nurse is caring for a client after seizure activity. What is the priority? A. Document event. B. Reorient client. C. Maintain airway. D. Administer anticonvulsant. Answer: C. Maintain airway. Rationale: airway protection always comes before documentation or meds. Question 43. A client with heart failure gains 2 kilograms in 48 hours. This indicates A. Improved cardiac output. B. Fluid retention. C. Muscle gain. D. Improved nutrition. Answer: B. Fluid retention. Rationale: Rapid weight gain reflects fluid overload, not fat or muscle. Question 44. A nurse is caring for a client with tuberculosis. Which PPE is required? A. Surgical mask. B. N95 respirator. C. Gown and gloves only. D. Face shield. Answer. B. N95 respirator. Rationale. TB is airborne, requiring an N95 respirator. Question 45. A client with hypoglycemia is conscious. What should the nurse give? A. IV dextrose. B. Glucagon IM. C. Oral glucose. D. Insulin. Answer. C. Oral glucose. Rationale. Conscious clients can safely receive fast-acting oral carbohydrates. Question 46. A nurse is caring for a client with bowel obstruction. Which finding is expected? A. Hyperactive bowel sounds. B. Absent bowel sounds. C. Increased appetite. D. Frequent diarrhea. Answer. B. Absent bowel sounds. Rationale. Obstruction halts peristalsis, leading to silent abdomen.
Question 47. A client with pneumonia should be placed in which position to improve oxygenation? A. Supine. B. Trendelenburg. C. High Fowlers. D. Prone. Answer. C. High Fowlers. Rationale. Upright positioning maximizes lung expansion and gas exchange. Question 48. A nurse is administering blood. Which action is correct? A. Use dextrose to prime tubing. B. Verify blood with another nurse. C. Infuse over 6 hours. D. Warm blood in microwave. Answer. B. Verify blood with another nurse. Rationale. 2-nurse verification prevents fatal transfusion reactions. Question 49. A client with Addison's disease is at risk for A. Hypertension. B. Hypernatremia. C. Hypoglycemia. D. Fluid overload. Answer. C. Hypoglycemia. Rationale. Low cortisol impairs glucose regulation, causing hypoglycemia. Question 50. A nurse is caring for a client with increased intracranial pressure. Which finding is most concerning? A. Headache. B. Restlessness. C. Bradycardia. D. Nausea. Answer. C. Bradycardia. Rationale. Bradycardia is part of Cushing's triad, indicating impending brain herniation. You just completed 50 Nclex questions that fail most candidates, and if some of these challenged you, that's a good sign. Nclex is not about memorization. It's about clinical judgment, priority, and safety under pressure. If this video helped sharpen how you think, like the video, subscribe to MCQs Master 101, and share this with a friend preparing for Nclex, because no one passes alone. Drop a comment and tell us how many questions did you get right honestly. More high-difficulty Nclex questions, next-gen case studies, and exam day strategies are coming next. Stay focused, stay consistent, and most importantly, pass Nclex the first time.